Hello, my name is Trine Hane, and I am a senior physician at Aalborg University Hospital Thisted, which is a small hospital in the northwest of Denmark. It's an honor to be able to tell you about our educational initiative, Cornea Donation and Training the Challenging Conversation. First, I would like to introduce myself and my colleagues. Jens Andreas Juhl and I are senior physicians and heads of education in our Department of Internal Medicine, where Martin Brink Termansen is a junior physician. Henrik Jensen is a hospital porter and chapel assistant and takes care of all the deceased patients in our hospital. He is the main leader of the educational activity that we would like to present to you today. Here you can see a little bit background information about our hospital. As you can see, it's a small rural hospital located in the northwest of Denmark. This is the agenda for the presentation. First, I will tell you a bit of the background concerning cornea transplantation in Denmark and how it can be combined with the training of the challenging conversation. Then I will take you through the methods and results of the educational initiative. Cornea transplantations have been successfully performed for about 120 years and is now the most common form of tissue transplantation in humans. The Danish Cornea Bank was founded in 1978 in Aarhus and was the first center in Europe to be able to store cornea tissue long term. About 650 cornea transplantations are performed every year in Denmark, divided between two hospitals, one in Aarhus and one in Glostrup in Copenhagen. Many people ask us the question whether they are able to donate their corneas once they are deceased, as most people think that they are too old or too sick to become a donor. In fact, almost everyone are eligible to become a cornea donor, with only a very few exceptions that we have listed here. You can register yourself as a donor in the Danish Donor Registry, or your relatives can grant permission for donation after your death. The cornea tissue is very special since it's viable several days after death, and it can be stored for several weeks under the right conditions. It is very rarely necessary to perform tissue compatibility testing prior to a cornea donation, and rejection of the tissue is very rare. You don't require any systemic immunosuppressive medicine after receiving a cornea transplantation. Here you can see some pictures of how we harvest the cornea tissue. It is performed by our hospital chapel assistant Henrik, who has received special training in how to extract the tissue, in how to prepare and store the tissue properly. Now I would like to tell you about how the topic of the challenging conversation comes into the picture. For all junior physicians in Denmark, training is required in different aspects of the medical profession. The competencies have been modeled based on the CanMed framework into the Danish version of the 7 roles of the physician. One of these is the role of communicator, since difficult or challenging conversations with patient or the next of kin is a frequent and necessary part of the medical profession. Thus, training these communication skills are a vital part of the postgraduate medical training. Requesting permission for a cornea donation can be very challenging or even intimidating for the junior physician. It's a very delicate situation where the next of kin are grieving the loss of a loved one, and you might be uncertain on how to phrase the request in a respectable and empathetic manner, while also offering some kind of comfort in a professional manner. In 2016, the hospital chapel assistants introduced an educational initiative that included a compulsory conversation conducted by the junior physicians with the relatives of the deceased about possible cornea donations. The chapel assistant provides communicational and legislative insight to the junior physicians before and after each of these conversations. As you can see on the pictures, the hospital chapel assistant will guide the junior physician through the conversation and give feedback afterwards. To evaluate this educational initiative, we wanted to do a quantitative measurement of the development of cornea donation at our hospital compared to other Danish hospitals. We also wanted to do a qualitative assessment of the junior doctors' opinions on using the conversations as a platform for training the challenging conversation. We did a survey by sending out a questionnaire to all the junior physicians in the Department of Internal Medicines. These are examples of some of the questions. You can find the full questionnaire in the stack. These are the results of the evaluations we did. First, we go through the questionnaire where we invited 19 physicians and almost 80% answered the questionnaire. 73% had participated in the project and found that in some or a high degree it had trained them for the challenging conversation. All the junior physicians experienced good support from the hospital chapel assistants before and after the conversations. They were also able to do some free text responses where they indicated that the training had given them courage to conduct more challenging conversations in the future, and it was very good training in communication with people in a crisis situation. We also wanted to look at the development of cornea donations at our hospital. So in a period from 2016 to 2024, we contributed 9.6% of all the Danish cornea donations, although we only have the patient uptake of 1% of the Danish patients. Thus, we were the fourth highest contributing center in absolute numbers, which we are very proud of. In conclusion, our evaluations found that all the participating junior physicians found educational potential and relevant support in connection to the obligatory conversation about cornea donation following in-hospital deaths. After the introduction of this initiative, the donation numbers have increased to one of the highest in the country. The focused communication training of the junior physicians was very helpful to overcome barriers towards asking for cornea donations. Our take-home message from this educational initiative is that the challenging conversation as a teaching objective is possible to integrate in the everyday clinical work. It's especially helpful to include other healthcare professionals, in this case colleagues who deal with the relatives of the deceased. If you would like to know more about the cornea transplantations or the CanMed framework of the 7 roles of the physicians, we have included some resources here. We would like to end this presentation by showing you a few pictures of our colleagues, our hospital, and the National Park Thy, which is near our hospital. We wish you a great conference. If you have any more questions, you can find the contact information in this concluding slide. Have a very great day.